Recording.
There you go.
Okay,
so we're
there
live,
we go.
everyone.
Usually it says record to the cloud. Okay, so good evening, everyone. It's 6:40, and I'm calling, Edwin and I are calling the meeting to order. Thank you for being here this evening with us, and we have a full agenda. Just in the last couple of days over the weekend, there's been so much activity, emergency activity. So we'll just move right along and so that we can get to that at the outset, because a couple of things will not be on the featured on the agenda. Can we adopt the agenda as is, adding at the top an update or information on the 340B plan from Dr. Danielle Milano, representing Heritage Health and Housing. And what else? I think that would be the main addition right now to the agenda, unless there's something is there something or someone here who
So I'll
doesn't?
put a motion to adopt the agenda, adding Dr. Milano.
I second.
Thank you,
All
Mary.
all those in favor on the
Aye.
committee?
I, but remember
Okay.
what I said, Laquita, the 340B letter, that 16 needs to be removed.
Okay, when we get, let's see, we'll probably get to that very soon. It could be
Okay.
mentioned again. Now, in terms of the minutes, we always greatly appreciate Patricia Ramos doing the minutes for us. That takes a lot of commitment and caring. So we just thank you wholeheartedly, Patricia. She got it to us today, a couple of hours ago. I didn't see it in time to forward it. So we can look it over, and if you don't mind, approve it approve it at the May meeting. Is that okay with everyone? Or do you want, okay. Monica, oh, okay. Is that okay with everyone that we table the minutes till May?
Sure.
Okay, so we'll go straight into announcements and presentations. So this would in a way fall as an announcement. Dr. Danielle Milano is the medical director for Heritage Health and Housing, running the Heritage Healthcare Center. And on Friday, we got an emergency that the governor on April 1 was going to announce cuts to the 340B plan. And apparently that would affect not only a number of FQHCs, but a list of other organizations that Dr. Milano sent in an email. And what I'd like to do now is have you address us. The initial call was from Sandra Blundetto, who is CEO of Heritage Health and Housing. And I really also at this point want to commend our board, because with our moving into action, Edwin getting Barry involved, I did too. We separately made our inroads, not knowing that one had done the other. So Barry acted, sending out an emergency text to our executive committee, and we acted on it and got good response. So let me just say now, Dr. Milano, will you present to us the issue and the crisis with the 340B? Let's see, you're on mute, Dr. Milano.
There we go. So what happened back in the early 90s, 1992, there was a bill passed that any pharmaceutical company that wanted to participate in Medicaid and Medicare, that they needed to, for certain 340B eligible, I don't know where 340B comes from, that these pharmaceutical companies sell their medications at deep discounts to 340B entities, like federally funded community health centers. And there are a number, it's not just federally funded community health centers. I can share my screen if you'd like, because I have the person.
Yes, let me make you a co-host.
I might be able to share. Oh, no. Okay. Okay.
Just made you a co-host.
Okay.
Okay.
Okay. Is it sharing? Okay, now it's sharing.
Mhm.
So this is so this is straight from HRSA, 340B eligible. So here we are, FQHCs, and as we was a health center program lookalike, it's a nonprofit clinic that is in the process of becoming a federally funded community health center. And you see Native Hawaiian, Indian, okay, Ryan White, AIDS clinics. And then we go down to, when we look at these hospitals, these are all hospitals that you must be a nonprofit, and they take care of a disproportionate percentage of patients who are uninsured or underinsured. So that is a criteria. There is sort of a base amount of, you must take, 15%. I don't know exactly what the percentage is, but it's somewhere around there, that 15% of your patients need to be uninsured or underinsured. And then we have a couple of other STI clinics. We don't call them diseases anymore. It's sexually transmitted infections. TB clinics, which are typically run by states and counties. So a lot of, and then when you actually open up something like, there are, no, I'm sorry, I have too many things going on here. Here we go. So, oh, I'm sorry about this. So in any case, so what happens is that when we talk about tuberculosis clinics, things like that, black lung clinics, those are usually run by states or counties. So, and cities. So city hospitals are eligible, state hospitals, county hospitals are all eligible to buy these medications at deep discounts and pass that on to their patients. And then we, federally funded community health centers, use the money that HRSA gives us each year in a grant. We use that money for our uninsured patients. We hire staff, we hire providers, care managers, so on and so forth. And then also it's good for our patients because some medications are extraordinarily expensive. And so one, penicillin that's been around for how many years? 50, 60, 70 years. So penicillin injections are unbelievably expensive, $1,000. And they're just maybe $1 or $2 on the 340B program. And so this is why it's so important. It's not just the federally funded community health centers. It's also hemophilia centers, HIV centers, and so on and so forth. So does anybody have any question about how FQHCs work? So we, the FQHC, buy the medications under this deep discount. And we have a contract pharmacy that runs our 340B, that's contract pharmacy, runs our 340B program. And when we send a prescription for somebody who's below 200% of the poverty line, the pharmacy is flagged that this patient is in a certain tier and therefore only pays $2 for their medications instead of $100 or $500. And that's a for example. Any questions? So of course, anything that involves the government has to be unnecessarily complicated and convoluted, as is the 340B program. So what has happened? And in the law, it's specified that the medications, these 340B medications, would go through Medicaid managed care. What New York State has done is said that that's out the window. All of your Medicaid managed care patients' prescriptions will no longer go through Health First or Metro Plus. It's going to go through New York State Medicaid, straight Medicaid. And what that does is it gives New York State that spread between the deep discount and what the wholesale prices of that medication. So a $500 medication that we can buy for $20 at this deep discount. The spread that would have come to us to pass on to the patients now is going to New York State. So from where I sit, I'm not a lawyer, it's not, but I did read that 1992 law, which is extremely boring and very long. It's not within the spirit of the law or the letter of the law. It was meant for federally funded community health centers. And a quote that goes around is that to make scarce dollars go further for federally funded community health centers who take care of the poor, the uninsured, we take all comers. So in any case, so Sandra spearheaded this current, the state actually tried to take it over a year or two ago, and there was a huge backlash and they backed off. And so now the state has gotten serious. We have this lawsuit. It's not over till it's over. And so Sandra continues to spearhead this in conjunction with Evergreen, which is a very large federally funded community health center up in Buffalo. And so there have been a lot of events, and Callan Ward and Housing Works said that they weren't going to walk in the New York City Pride Parade if Governor Hochul will be there. Buffalo said, don't even bother coming up here. We don't want you up here. And so what Sandra points out is that Buffalo and New York are really the two areas that elected her. And so, okay. So she doesn't want to antagonize the people who elected her. But Sandra also said is that she's really not captured. She's not really, the governor is not really realizing what it is. She said, no, everybody's going to be made whole. We're going to give you money next year. Oh, gee, thank you. That doesn't do us any good. And their estimations for how much they will give us to make us whole vastly underestimates what we are actually owed. So with all that said, it's not over till it's over, and Sandra is continuing this lawsuit. It's certainly still in process. And then there's Amir, what's his last name, Basari, is a throwback to the Cuomo administration. And so when the Cuomo administration was many people who clinical people who worked at the Department of Health under Cuomo left. And then with the pandemic, it's estimated that they're down to 40% of staffing of clinical people. I remember the day back when, I had a question about, treating a patient with, tuberculosis, or I had a question about a vaccine. I could call and I could actually speak to somebody at the vaccine area, in the TB program, and have a conversation with an expert about how to take care of a particular patient. Those days are gone because there's so few people, competent people, who still are working clinically at the Department of Health. And so in any case, that is where we stand. And are there any questions?
I'd like to just point out, I emailed to the committee, and Edwin, maybe you can show this. There's a letter of support, although I'm sure there are some questions as well. I just want to point out that there is a suggested letter of support, and in that letter of support, I just want to point out that the letter commends Mayor Eric Adams in opposing the 340B carve out because it runs counter to accomplishing the goal of reducing disparities in health outcomes of minority communities and LGBTQ plus people. They also say that, and maybe you mentioned this while I stepped away, Dr. Miano, that there is a compromise legislation introduced by Senator Rivera to implore the legislature to correct the wrong in this final budget negotiation. And the commissioner of the New York City Department of Health and Mental Hygiene also has been vocal to this opposition of the carve out. The only thing is I just don't understand why Governor Hochul was so strong on this and against all the opposition to it. So
well, it's about money because they're trying to close their budget deficit, and that 340B money was not meant to close New York State's budget. These are my feelings. They want to close a budget deficit. Hey, let's go. This is easy. We can ease. This is easy money for us. Not so fast, because it's supposed to be for the patients, and you're absolutely correct. This is health disparities, and this is I believe, I try to avoid all things legal, and sometimes I can't, but the premise is, it's in the New York State Constitution, similarly situated people must be treated similarly. So who does the loss of the 340B money hurt, right? The underinsured, the poor. The underrepresented, Buffalo has many LGBT, a large LGBT community. Certainly they're impacted. This is a health equity problem. It's not just, they're looking at as a money problem, and they're forgetting about the people that they serve, that they're supposed to serve, right? The people aren't supposed to serve them. Yes. Thank you.
Are there any questions for Dr. Milano regarding or about the 340B? This was kind of, even though there's been an issue with it for a number of months, I understand it's been longer than that, a couple of years, but all of a sudden, I suppose no one thought that or had any thought that the budget would be cut. So it just became an emergency on Friday. So I don't know what's happening, the latest on it now. We don't have an update, but there is a letter of support. And I know Monica keeps mentioning a number 16. I'm not seeing it on the document that I have, but if there's
I think number 16 reflects a business that's opposing
Yeah.
the loss of 340B. I mean, like it's a business, it's a small business, so I believe it should be there because it affects, small business owners as well.
I don't think a pizzeria shop belongs on a letter like that.
Well, if this is just a suggested letter, I think, again, I'm not seeing it. So, Edwin, can you take over the discussion for a second? I have something that's come up here.
I wanted to bring up the urgency of this matter. Right now, millions are about to lose their Medicaid coverage from the pandemic protection. So the folks that we have now without insurance is only going to increase. And to have this bill now taking away more from the poor is just going to continue to create the same insanity that we have seen in the US. We have seen the worst life expectancy in decades in this country because of the pandemic. But, people like to think of life expectancy as only affecting the elderly. No, it's not. This is looking at the aggregate for the entire nation. So you have a lot of, young folks also dying. And we cannot continue to create more barriers to access to care. So I encourage everyone to not only help us on this petition, but to also call the governor and call your legislator, and let them know that we oppose any cuts that has to do with healthcare access in our community.
Okay, I'm back. So where are we on the letter of support that was circulated to the committee? Is that where we are?
You can put up the letter, Laquita. I was just telling everyone that, not only here at the community board, but everyone that's here, whether you are a board member or just a community member attending, this is something that behooves all of us. Everybody talks about access to care, mental health, and etc. If you do not have access to your medication, if you do not have access to the providers, how are we addressing this? We're not going to arrest our way out of, poor access to care. And this is a critical part of an infrastructure that helps millions of people. The only country that attaches your employment with your health is the US. In other parts of the world, people don't have to worry about that. Many of you are not leaving your jobs, are unhappy in your jobs, and you have to stay because you need your health care. It's just insanity. We shouldn't double down on the poor. And I know that the governor is very keen on safety and increasing the budget for law enforcement. I mean, it's insane. China has 2 billion people, yet we have, the most number of people incarcerated in the world, the United States, 340 million people. Are we going to continue to arrest our way out of this? No. Let's, keep a program that is working. Let's figure out how we're going to bring the money. She knows how to do it. She can tax the rich, but that is not appealing for other reasons. So Laquita, you can post it up. I can go on and on about this.
Right. I want us, we can, since we're talking about it as a letter of support, let me bring it up at the end, but because of the time constraints, I wanted Dr. Milano, and I thought Sandra Blandetto would be available at this time, which is why we arranged it. We just had it at the opening. So we can bring it up again, but we do want to do a letter of support. Okay, any other questions though while Dr. Milano is here? Do I see any hands up? I don't see any hands up. Correct me if I'm wrong. Thank you, Dr. Milano. And
yes,
so
thank
we
you.
will
I appreciate your advocacy.
And this is really critical. We did give a verbal support based on our review of the budget coming to the city, and we talked about it a month ago, being too many cuts to health. And so this supported that same thought, and we wanted to just say, yes, we have to support any effort that's going to mitigate against these cuts. And Dr. Milano, if you please, you're invited to stay with us for as long as you can with the rest of the meeting. So if we can, we'll move forward to an update on our Mount Sinai letter of support on pediatric psychiatry. And at this moment, we just wholeheartedly applaud our board member Ileana Mercado for bringing up an incident that occurred in Mount Sinai Hospital in a pediatric situation where her 13-year-old was in the adult pediatric department. We, at the March meeting, supported Ileana's distress at what her 13-year-old had to experience. And the letter was signed by our general board chair, certainly, first of all, unanimously supported by the general board. And we did, after a while, hear from Mount Sinai in a very general way. And Ilyana was contacted directly. So in that sense, our support gave her additional support, but I'd like for her to talk about it. And we have in the interim talked with her, but we'd like for her to at least give her follow-up to what this support has meant to her and how we need to move forward. Ilyana? You ready? Let's see
Hi, can you
where-
hear me? Can you hear me?
Yes, yes,
Oh,
we can
hi.
hear you.
Okay, great. So, yeah, so just basically like with the follow-ups, I was contacted by patient services like twice, and I don't think they really understood what the letter of support was. They were kind of like, oh, so what can we do for you, And again, this was like the third or fourth time I've received that sort of response, from patient care. They had sent like 2 letters basically justifying the way that the patient, saying that they felt the care was appropriate for my child, and that it was like that was the safest place for them, which is like absolutely absurd. If anybody's read the fact pattern, if
Incident
you
report.
will, that I wrote about. Yeah, the incident report. Yeah, thank you.
Uh-huh.
So anyway, so today, so then I called them. I called this person, Nicole Sailors, Rana. She was the one who wrote the latest letter. And I explained to her, like, no, we want you to address this on a community level, because yes, this happened to me, but I'm also a member of the community board and discussed it with the health committee. And this is something that's affecting not just my child, but, children in the community. And so they said, oh, we have been in touch with the district manager, and we're sorry we didn't tell you that. I'm like, yeah, thanks. So then I know that they were going to come. The representative, I can't remember his name. I know his name is Brad. Brad Korn. I can't remember.
Korn,
Don't
government and
Korn,
community
yes,
relations.
government and community affairs. So he, I know, contacted you. Sent me the email. They were going to come, but they couldn't come today. But they said that they could come in the future. So I actually called him because, again, he was kind of reiterating some kind of like some of the same kind of false information that had been going around from with the response with patient services, basically saying that, well, my child was put in the psych ward because there was nothing physically wrong with them, and that the night before they were in the pediatric ward because there was something physically wrong. That's not true at all. So I actually had to explain everything. And we had I had a very passionate rant, if you will, and he listened. And he actually, this was the first time that I actually felt like somebody at Mount Sinai was actually concerned about the way that I was treated and my child, the way that we were treated, the miscommunication, the lack of communication, that, and now he did reiterate, yes, it is their policy to put 13-year-olds in with adults. But I did say, this is something that if perhaps if the hospital is not willing to separate by age, then they can separate by care. I mean, first of all, for a child that's a minor child that's going in there for being treated for self-harm, thoughts of self-harm, to be placed in the same room where you have adults that have very different needs, a lot of adults that are unhomed individuals that are suffering from different, and a lot of them are displaying different behaviors, and it was very scary to my child to see that. And then the only folks that were in there dealing with that were security guards that were not trained, that were very rude to me and my child, and very, just not appropriate staff to have dealing with youth, especially, or maybe even adults. So that's a whole other discussion. But he was open to the fact that we could talk about improvements for policy. I mean, again, he's the government and intergovernmental affairs spokesperson, but so I don't know how much leeway he has to kind of talk about that off the bat, but he was willing to come back and talk about these issues that are concerning all of us. So I thought that was great. I was very
That is
happy
good
again with
news.
the way that he handled it. So hopefully, fingers crossed, going forward, when he comes back, when they come back, we can have that conversation. And I would like to take this. I mean, I don't know. I mean, I think Edwin had mentioned, maybe this is something that we could, elevate for some sort of legislative change where kids can be placed in separate facilities from adults, that kids that are displaying self-harm or have other issues can be placed with a certain age appropriate level of care. Because to reiterate, when my child was in the pediatric ER the night before, and they had that as a courtesy, which again they didn't tell me, my kid left there very calm. That it was wonderful. I mean, there was the psychiatrist saw my child, and there was a nurse, and they took very good care of my child. And compared to when my child left the adult psych ward, my child was shaking. I mean, it was very traumatizing for my child and for myself. And now my child said, like, they're afraid to kind of say that they're having self-harm thoughts because they don't want to go back there. You know what I mean? Like, so like, that's not helping kids, that's hurting them, because if they don't feel safe enough to disclose that, then God forbid they would do something harmful to themselves because they don't want to end up in that psych ward again. Do you know what I mean? So I mean, like, that's not supposed to happen. So there's a lot of reasons why this policy should be, examined and revised. So anyway, that's my spiel. That's my summary. So
Thank you so much.
Hopefully they'll come back and we can start that discussion process.
Thank you, Ilana, and thank you for bringing this up to the attention of the community board. Thank God, that you have the political capital and the social capital to raise this issue, right? As you said, how many others in the community have dealt with the same issue, and because of language barrier, because they don't have the same connections, we don't know of. So it's, they're not doing us a favor. And Laquita, you and I will follow up with Sinai. They have a duty to come and speak with us. Any institution in CB9, they have a duty to provide good services and to come and speak with the community. They're not practicing, and they have their institution operating in air. They are in our community, and they have to be good members that are contributing to the health of our community. So we have to follow up with these folks. We want them here in May. They're not doing us a favor. And Laquita, you and I will be calling them, because it is unacceptable for any institution in CB9 to think that they're doing us a favor by showing up here. They're not showing up, they're showing up for the community.
I think that's absolutely correct. And what we can do, probably set up some meeting. Anyone on the committee wants to sit with us, Yana, and kind of look at in more detailed way what we want to achieve from this first actual meeting with them. So I absolutely agree. And we talked about protocols. And if there's any information that anyone has with someone else who has been mistreated, please get that information to Edwin or I or Ilyana somehow, so we can know. But it must be pretty bad. There's something is going on, because even the Attorney General, Letitia James, had a statement out, a request, please report any not so much misbehavior, but unpleasant experience that anyone suffering from some kind of mental health issue has experienced with our hospitals or other facilities. So we know that you're not the only one. There are other people out there, and this is the time to act.
And I will emphasize that anyone who wants to come up and speak and they want to stay anonymous, we can do that. We just need to understand and get a pulse of what's happening. Here, we are very lucky that Ilana is in the community board, knows how things work, but many others who experience this, they probably do not know where to go and who to talk to.
So two
Exactly.
things.
Question,
Can I, sorry, can
please,
I,
Oh, Monique, okay.
sorry. Alana, I want to follow up with that. I'm sorry, the hand raise isn't working, but I want to follow up. So two things. So I actually did file a complaint with the Attorney General as suggested, and they actually called me from the office. They were a little confused, and they said, "Oh, I should call like health and hospitals." But then I told them, I said, no, like I was told to do this. And then they spoke to their supervisor and they said, okay, fine, we'll investigate. So there might be a little confusion, but just stick to your guns if you do file, if anybody is having this type of situation, maybe this is something new there, but they are working on that. The other thing is I did mention exactly what you said, Edwin, that, I'm able to advocate because I understand how to navigate, government and because of my board experience. But at the same time, I said, I'm sure there's plenty of kids that don't have that. They don't have those resources and families that don't. And the same exact thing that there's kids in there alone. He actually listened because he said, I'm concerned about like the mishaps in communication, whatever. And I said, well, I'm pretty sure I'm not the only one receiving this treatment. So they said that they are looking into it on a personal level for me and on a larger, organizational level as well. So that's it. Just wanted to say that. Thank you.
Monique,
hi, everyone. Thank you, chairs. Question, I wasn't clear, what was going on with Mount Sinai that they didn't come this evening? And are they open to following up or presenting to us? So that was my question. Thank you.
basically, Brad Korn's letter, and Brad Korn is the director, I believe his title is Director of Government and Community Affairs. And he basically just said that they were unable to attend. He was not as up on the issue. It was emailed to him this past Thursday, and I suppose he had to contact a number of people and all, but he did say that they wanted to be available to us at a future meeting. So it's not, so I suppose today was too soon for them. Not feeling that he was on top of everything, but they have offered, he stated that they do want to come and plan to come and talk to us and be available to answer questions. So if that is the May meeting, I think we should get on it really quickly, but let's talk again with Ilyana in terms of, specifically in terms of that protocol that she has, talked about and enunciated in the letter. We can go back. It was a long incident report, very thorough. And so we want to make sure that we cover what's going to be important, not only to her personally, but to our community. It really is a community issue. But
Thank you,
I
Chair.
don't know if that answers it, Monique, but I'll find the email and I can email it to our committee. I forwarded to Edwin. I'm not sure if I forwarded.
I think I saw it, but I didn't, like
Yeah,
I
I think
said,
I forwarded that to the committee. So you just
I
have
was-
to look for the
Yeah,
email. It was,
I'll look through it again, Laquita, to see what the tenor was and what the next steps that need to be addressed or looked at so that this incident doesn't go
yeah, we're all gonna be on it,
unaddressed.
so
Yeah.
we want you,
Yeah.
we'll make sure the committee knows everything, and there may be some input. We'll probably have to set aside some time in between this board meeting and a committee meeting and the next committee meeting, maybe a call for 45 minutes or so.
And
Okay,
for
thank you.
context, real quickly, if you have a child who has asthma and they're 15 years old, 17 years old, they are not going to go to the adult ER. They will be placed in a pediatric ER. So are we saying that we're okay in our community to have mental health crises to be addressed in a different manner? This should be getting the same priorities that other, medical illnesses they receive.
Now, one thing he did say in the letter is that they were providing us with some important updates. They supposedly have patient safety and well-being are the priorities. Anyway, I think what I'll do is it's a long it's a not super long letter, but it is sort of detailed. And I will forward it to the committee at this point or shortly so that you can see it. But I'm pretty sure, I'm just checking again. I may not have sent it, so I will forward it so you can look at it, and maybe before the meeting is over, if there's additional input, it can be discussed. So let me, I will send it now. Any other questions related to this update? Thank you so much, Ilyana. And you're very, very brave and as committed, and we are, and informed. And so we're very grateful to have your willingness to see this process through, because we do
Well,
want to
I
resolve
want to mention
it.
my child was really the one who wanted to speak out. I mean, obviously, I wouldn't do this without their permissions. So they were really the one that wanted this addressed and felt, that this is the appropriate course of action. So thank my child and thank you for, helping me with this. I greatly.
Thank you again. Next we have, if we can move forward, a presentation let me go back. I was forwarding the letter. Let me go back to our agenda. Clinical trials and services offered to the community from Columbia University Herbert Irving Comprehensive Cancer Center. And we very much appreciate Columbia University's Medical Center really actively being involved with providing information to us. We reached out to them because we wanted the connection. They have brought information to us based on what their needs are too. And they're somewhat mutual in that we do need research in our communities. There are areas of healthcare, health issues that our community, members of our community are experiencing, and where there may not be as much information as we need. So the question was, how do we get people to participate? How do we get our communities involved more and get beyond some of the old, well, they're not necessarily, they're old, but they're not necessarily unwarranted, but some reluctance to participate in clinical research. So we've been getting answers. We've gotten good responses, and I believe a couple of the departments have gotten responses from others who have come to our meetings and want a connection with Columbia as well. So tonight we have, they contacted us, Susie Murphy, who's the outreach coordinator at Clinical Protocol and Data Management Office, and Brianne Bolden, who is an oncology research nurse manager. I believe, let's see, let me make you both, co-host for your presentation. And while I'm doing that, Susie and Brianne, you can at least and talk, say more, say something further about your other. Okay, go ahead. I'm in the process of making you co-host.
Hi, I'm Susie. Oh, okay. Yeah, I'm Susie. I'm the outreach coordinator for the department. So anytime there's a community, health fair, or if there's ever a meeting or an organization that wants us to come out and just provide community education and information on trials, like, we are happy to come out. So if you guys ever need me, we come on weekends, we come at night, come in the daytime. If there's any time that you guys have a function where you believe that we would be a good fit, please reach out to me and let me know. And I will see if I can get out there and meet with you guys. And then Brianne is our nurse manager.
My name's Brianne. I'm a registered nurse, and I'm the manager of research nursing and outreach at Columbia and the Cancer Center. And we're really so grateful for the opportunity to speak with you today. I'm going to just see if I'm able to share my screen.
Yes, you're both made co-hosts. And when you get a chance, please share your information in the chat.
Yes,
Contact information.
absolutely.
Mhm. So your presentation will be no more than 8 minutes so that we can have time for Q&A.
Yes. Okay, can you see my screen?
Yes.
Okay, so I just wanted to start off with a little bit of background information about what clinical trials are. So clinical trials are research studies that involve people. Conducting clinical trials is the way that scientists and doctors find new treatments for all kinds of health problems. As I mentioned, I work in the Cancer Center, but clinical trials certainly are not limited to cancer only. At Columbia, we do have quite a few. I believe it's about 350 clinical trials just for cancer, but there are many, many other health conditions and fields that clinical trials are done for as well. Every clinical trial follows a plan that's called a protocol. So the protocol contains information about the goal of the trial and also has rules for who can participate in the trial, which are the eligibility criteria. So the eligibility criteria are different for every study depending on the type of trial, the treatment or intervention that's being studied. But some of the most common examples are age, gender, the type and stage of a disease, previous treatments the person has received, as well as other medical conditions that they may have. And there are all different types of clinical trials, each of which is designed to answer different research questions. So one of them is treatment trials. So that's when we test new treatments or combinations of treatments, or and that could be a medication, or it could be a new surgery or radiation therapy, any other type of treatment for an illness or disease. Prevention, or more appropriately called risk reduction trials, are trials that look for new ways to reduce the risk of a disease occurring or returning. Screening trials test new ways of detecting a disease or health condition, and supportive care trials or palliative care trials focus on ways to improve the quality of life of people with certain health conditions, to make them more comfortable, to be able to decrease effects that they may be having from their illness or effects that they may be having from certain treatments. Okay, so why are clinical trials done? Clinical trials are conducted for many reasons, a few of which I've listed here, to find ways to detect a health condition earlier or possibly prevent it altogether, to determine if a new drug or device is safe and effective for people to use, if it works well, to find different ways of using existing treatments so that they'll work better, be easier to use, or have less side effects, or to learn how to use a treatment in a group of people where that treatment hasn't been used before. So sometimes that means, if a treatment has been tested in, say, adults, treating it, trialing that same treatment in children, or there is a treatment that has been approved for one health condition, and then sometimes there's an incidental finding and we notice that it seems to be working for something else as well as an unintended side effect. So then it can be studied in that indication also. Are clinical trials safe? So there are ethical guidelines that researchers follow when conducting clinical trials that prioritize keeping the people that are participating safe, making sure that they're treating fairly. There are also federal regulations that are in place. There's quite a bit of oversight and monitoring involved in clinical trials to make sure that everything is being carried out safely and ethically. Some of the ways that people are protected are through the informed consent process. So the informed consent process is the process of learning important information about a clinical trial before someone decides whether or not to participate. So this is typically a pretty involved conversation between the person considering a clinical trial, the potential participant, and the research team. So that might be a doctor, that might be a nurse, It might be a research coordinator, depending on what type of trial it is. It could be a group discussion. It could be all of those people. And they'll discuss details about the trial, such as why it's being done, how long the trial is expected to last, any tests or procedures that will be done, if there's any known side effects that they could expect, possible risks and benefits. And then in order to enroll in the trial, after this informed consent document is reviewed, the participant would need to sign the form, and then the person that reviewed the form with them, either the nurse or doctor, signs it as well. And one thing that's really important to know about clinical trials is participation is not only is it completely voluntary, but participants can also change their minds at any time and for any reason. So if someone decided one day to participate in a trial and the next day, for whatever reason, they decided this isn't something I want to do, that's okay. And you know, that is completely fine. And it doesn't change anything in terms of the care that someone receives, how they are viewed by their care team, anything like that. So we like to say consent is an ongoing discussion. And we also, you know, as we, the research team, learn more about these treatments, we also share that information with participants. So as the trial goes on, if there is a side effect that seems to be coming up a lot, that's something that anyone involved in the trial would be made aware about. And as I said, they could, you know, you can make the decision at that time, knowing that possible side effect. Is this something I want to continue in? So it's an ongoing discussion. Another way that people are protected is by the involvement of an institutional review board, also known as an IRB. So the IRB is an independent committee made up of doctors, statisticians, community members. Before a clinical trial is started at a site, it is approved by the IRB, and then it continues to be monitored by the IRB. And the whole purpose is really to make sure that participants are protected, that they are being treated fairly, and that the risks of the trial are minimal when compared to the potential benefits. And then lastly, there's also very close monitoring by the research team. So as I mentioned, that's doctors, nurses, they monitor for any changes in health status, any possible side effects. And there's also a lot of education that's provided about the study and the treatment being tested. So there's, you know, we like to joke, you know, when we have people that choose to be involved in a research study, we kind of become, you know, a new friend, because they are in such frequent communication with us. And a lot of times it's just a quick touch base to see how they're doing, but it's definitely very, very close monitoring.
Brianne, so you've been on for 10 minutes.
Okay, I'm almost done. Wow, that went by quick. All right. Just really quickly, I want to touch on what a placebo is. You may be familiar with this term. It's basically looks like the treatment, but it has no treatment value, sometimes known as a sugar pill. The big takeaway for this is that any clinical trials for serious health conditions do not include placebos. And if you were to consider a clinical trial, you would know ahead of time if there was the possibility of receiving a placebo or not. We can skip this one in the interest of time, but the takeaway is just that people consider clinical trials for all sorts of reasons. Sometimes it's because standard treatments have not worked. Other times it's because they want to contribute to medical knowledge and help those with similar health issues. And then so just really, really briefly, so different people can experience the same disease differently, and can also respond to the same treatment in different ways based on their biology, environment, behavior, life experiences. And, you know, our life experiences vary based on who we are, where we live, our race, our ethnicity, the money and resources available to us. So that's why it's important to have people of different backgrounds involved in clinical trials. Treatment should be tested in the people that they are meant to help. So, you know, that means people from all walks of life. So what we would really like to do is make sure, this is a kind of a key focus of our department, that we're making sure clinical trials are accessible for anyone who may need it. And one of the ways that we do that is through our outreach and navigation team. So we have outreach coordinator like Susie, we have nurse navigators that can really help make sure trials are accessible, answer any questions that our community may have about clinical trials in general, address any concerns. If there's a specific trial that you might be interested in, we're happy to assist with that as well. But really, we just want to have a presence, share information, and be people that you can count on should you need us. But I know I'm over on time. So
well, that was particularly who should be involved in the clinical trial. That's also important to know. Let's see what comes up with our Q&A. So even though you went over, we appreciate the information, and let's just see what questions people have. Let me see if there are any hands up.
I'm also just sharing my direct email in the chat.
Chair, I can't raise my hand.
Oh,
I have
okay, Monique. Okay.
I have a quick question. Thank you, presenters, this evening. Do you work with Dr. Williams as a part that was a biomarker study? Is that all one and the same?
So Dr. Williams is not a part of our department, but we have worked together on various projects. So I am familiar with the project that you're speaking about. I know he has been engaging different members of the community, working on developing a community advisory board, and we are working with him on that.
Is there a follow-up, Monique? Monique, do you have a
I
follow-up?
think she said no. She's muted.
Oh,
So
okay.
so a lot of times, many institutions, they collect data from the community, but then that data is not reported back to the community. This goes into a journal, which many times folks in the community, such as those in the community board, will not have access to unless they are attached to a institution, hospital, or university. What are you guys doing to disseminate this information once you gather it, once it's analyzed, so we can get it? Because we have had many presentations by Columbia trying to gather folks. This is part of the recruitment process to get more people into these trials. But we have not had the presentations coming back and giving us the results of these trials so the community can learn of what was the outcomes from the studies that were done.
Yeah, that's something that we are really working on. One of the issues that we face is a lot of times there's a really pretty significant delay actually in when the time that it takes for the data to be collected, analyzed. A lot of times, to be very honest with you, the participating institutions don't even receive the results of the study until a couple of years out, because a lot of times they're sponsored by pharmaceutical companies or other industry partners, and they're open at many different sites. So there's just a lag. There's a lot of lag time. But this is actually something that we just discussed as last week, that we are working very hard to try to figure out a way to make sure that that information does get relayed to the community. And truly, we welcome any input you might have on how you would like to receive that information. If it would be, if you would like us to host meetings, if you would like us to join community board meetings that you have, we really value your input too, and we want to do what works for you.
Oh, there's a lot of background.
I know. I don't know what's up with that.
You can mute them, Lakita. You have the power to do so.
I don't know where it's coming from.
This is from
Coming from Monica.
Monica. You can mute Monica. Okay. So Brianne, thank you for that. There was a study. I mean, I have access to them, but it's not my duty to come and present the great trial that was just concluded nationally, which Colombia was part of this. I think the institution has the power to do so if they choose to. So this was a study done in patients with diabetes, and everyone here would like to hear these things. So you have a platform where we meet every month. The institution, they have, the folks that can present the results from these studies. The grade was presented last year at ADA. Tons of information on this. I think that that shows good faith to the community, to those who are here now, to say, hey, I would join this trial, but then later on, we're going to learn from it. Because it's not only, let me gather the data, we interpret it, and then it goes into a vacuum.
Yeah, absolutely. No, 100%. And I mean, if this is the best way for us to reach you, like for us to join these meetings, we are more than happy to do that. And again, like I said, I work within the cancer center, but I imagine that the other disciplines, like you mentioned diabetes, I would imagine that they would be very happy to share as well. So I can certainly reach out to those different departments, and that's something I can bring up with them.
That would be great.
And it would enrich the recruitment, because then people will say, look, they're not only collecting the data, they're not only giving me a Metro card or a Target card, then we learn from this.
Right. Yeah.
How long is
Dr.
Oh, go on.
Torres, thank you for saying that. And I'm sorry, I didn't mean to cut anybody off. It is important that that information is brought back, because it's seen as something that is beneficial to those in the community. And it opens up Columbia as being somebody who is sharing, engaging, and not just coming in and taking stuff away. So I'm glad Dr. Torres made that statement. Thank you.
Absolutely. And let me just ask, how long is the average clinical trial? I mean, how much time is there generally? Is it 6 months, a year?
So it truly does vary from one trial to the next.
The trials that you're working on now, are you in a 2-year kind of, what are the ones you're working with now?
So they
average amount of time.
they do change sometimes, especially in cancer. Sometimes it's a finite amount of time where someone will receive a certain number of treatments, whether it's for 6 months, a year, 2 years. They're receiving a predefined course of treatment. Other times people can participate in studies until that treatment is no longer working for them. So, sometimes, unfortunately, that can be quick. It can be just a couple of months. Other times, I mean, we've had people on some of our studies that are on for years. It really does, it honestly does vary just based on the trial and the participant and how they respond to the treatment.
Is there something that you might be able to report on in a month in your area, within a month? Do you have a trial that?
Are there any particular areas of interest? Like,
well,
is there one type
no,
of...
just your area, since you're in the Comprehensive Cancer Center, just in your area.
Is there one type of cancer that you would prefer us to focus on, though? Say breast versus lung versus, or not in particular?
I'm just trying to gauge if there is something that could be forthcoming.
So I don't want to put you guys on the spot. I think that this is something you guys can go back to. Every month we have an awareness month, right? Like I believe last month we have colorectal cancer. So it's a good opportunity to say, hey, we did a trial on colorectal cancer. This is what we looked at with the folks in Harlem, in upper Manhattan. And this is, the results. To your question, Laquita, how long can trials go? We have trials that have been going on for 30 years. And it's ongoing. And, we have one that is called the Diabetes Prevention Trial that started in 1996. We have the nurses trial as well. So trials, it all depends. Depends of the aim of the trial and how long you're going to run it for.
Right. But my next question was, if there was something that was imminent that they did feel they could report on.
So that's what I was telling her, that, they having some discussion, and every month, you have breast cancer, prostate, skin cancer. So that will be something that will fall in, with whatever awareness month is taking place. And of course, any other pertinent data, it will be very nice to share with everyone here. Because we have a lot of stakeholders from the community. Here we have Dr. Milano from Heritage Height, and other players. We have WEACT that deals with environmental. So these things are intertwined. And these are folks who have a very big outreach in the community.
Yeah, if you will have us, we would love to come back and share more information. And I can speak with we have many different investigators, the doctors that run our trials. And I would also like to pull them in because they would probably be the best people to report on the outcomes of some of the studies. So I'll ask them to come join as well.
Absolutely. That would be great.
Thank you.
Thank you so much.
Any other
You guys.
questions? Okay. So I think we'll catch up with any time lost because I don't see Department of Health and Mental Health here. Speak up now if there is a representative from Department of Health and Mental Health. Okay, so we will move now to the aforementioned reference group, WEACT. And Lewis Bailey, manager of membership and organizing for WEACT, is here, and he has brought along Michaela Martinez. Dr. Martinez is an ecologist and justice advocate, and they have at WEACT a program, Beauty Inside Out campaign. So Lewis and Dr. Martinez, take it away. Do you need me to make you co-host?
Yes.
Both of you, okay.
So good evening, everyone. While Dr. Martinez is getting access, good evening. My name is Bailey. I'm the manager of membership. Laquita and Dr. Torres, and of course, CB9 H&E. Thank you so much for allowing us this platform. Just want to briefly introduce Dr. Michaela. Part of some of this work with Beauty Inside Out will be done at our membership meeting as well. Our membership meeting is this Saturday, April 8th, and that's going to be at 10 a.m. It's going to be at 545 West 155th Street at the Prince Hall. So I'm going to put that link in the chat, but I'm going to turn it over to my colleague, Dr. Martinez. Dr. Martinez, take it away.
Yeah, thank you so much, Bailey. So today I wanted to give all of you a brief on our Beauty Inside Out campaign. So our Beauty Inside Out campaign was launched in 2019, and it's mostly focused on getting toxic beauty products out of our community and raising awareness about some of the most toxic products that our community is facing. And so what's the issue? The issue is that in the United States, there's very little federal oversight in terms of what chemicals can be used in cosmetics. And so some of the most harmful chemicals that are found in cosmetics are concentrated in cosmetic products that are marketed towards women of color. And so the two types of beauty products that we're most focused on in the Beauty Inside Out campaign are skin lighteners and chemical hair straighteners. And as I mentioned, these products that are marketed towards women of color tend to have incredibly toxic chemicals within them. And so skin lighteners often have mercury and or hydroquinone, and I'll explain what those are in a moment. And these chemicals are used in skin lighteners because these chemicals will block the skin's ability to produce melanin. And so that's why they're put into these products. And chemical hair straighteners tend to have either formaldehyde in them or ingredients that when mixed together will release formaldehyde. And I'll go in a little bit more to those particular chemicals. But WEACT, I'm new to WEACT, so I wasn't here when this survey was conducted, but WEACT did recently complete a survey of women and femme-identifying individuals residing in Northern Manhattan. So we had 297 individuals, and all of these individuals were asked about their use of skin lighteners and chemical hair straighteners. And also, if they use these products, why did they use these products? And what we found is that in Northern Manhattan, there's actually quite a high rate of use of both of these product types. 25% of all survey respondents reported using skin lighteners at some point in their lifetime, and 44% of respondents reported using chemical straighteners at some point in their lifetime. And these results varied a bit depending on which demographic group you were looking at. Asian respondents had a higher overall use of skin lighteners, and Black respondents had a higher use of chemical hair straighteners. And so why are these products dangerous? So these products, they essentially have two health impacts. One is a physical impact on us biologically, and then the other is the psychological and or social harm that these products provide or do. So mercury is a neurotoxin, and what that means is that it can damage your nervous system. And so mercury being present in skin lighteners can damage the nervous system, and the symptoms can manifest in various ways. Hydroquinone, which is the other common product in skin lighteners, can cause rashes, facial swellings, and also permanent skin discoloration. And for formaldehyde, which is the chemical that's often found in the chemical hair straighteners, is a known human carcinogen, meaning that it can increase your risk of cancer and cause cancer. So one of the things that I wanted to point out, which I think is particularly important for this group, is that these products are widely available in our neighborhood. I took this picture on 143rd and Broadway. This is just the storefront of one of our local beauty supply stores, and you can see here 3 shelves full of skin lighteners. And with some of these skin lighteners having had been tested for mercury and had mercury found in them, particularly this Cara White. I found one scientific paper that had tested Cara White and had found mercury in it. So these are very prevalent. I would encourage you next time you go to the pharmacy or a beauty supply store to take a look down the aisles, and you will see skin lighteners and hair straighteners very prevalent. And so what are we doing? So with the Beauty Inside Out campaign, we're going to be conducting a marketplace campaign that starts to target distributors that are getting these products into our neighborhood. There are some new laws that have just come down the pipeline. One in New York State that is now banning mercury from cosmetics. And so we can hopefully lean on that law to get some of these distributors to stop bringing these toxic products into our neighborhoods. And then also there's a new law federally that is banning hydroquinone from over-the-counter cosmetics. And so we hope to lean on that also to target some of these distributors. We have also been conducting educational events. On April 28th, we will be having a Beauty Inside Out block party. It's going to be in collaboration with Brotherhood Sister Soul. So it's going to be right there on the corner of Amsterdam and 143rd, in which we'll be providing educational materials to the community, particularly focused at youth outreach. And so we also have a Beauty Inside Out working group, and you can join this working group by emailing me, and my email is right here, michaela.martinez@weact.org. I will put it in the chat. And you can also come to our membership meeting where I will give a long form presentation on Beauty Inside Out and toxic chemicals and cosmetics this weekend. You can also become a member of WeAct and sign up for our mailing list. And with that, I will take questions. If anybody has any questions, you can feel free to unmute yourself and ask.
Aquita, you're muted. You're still muted.
Yep, I had to grab the phone. Thank you very much for reminding me. I don't see any hands up in the And I don't see anything on in chat right now. Let's see. Yair has said encourage the community to download apps like the Yuka to help them analyze the products that we are buying. Are you familiar with that, Doctor?
I'm not familiar with that app in particular, but we do have 3 apps that we've been trying to help push out to the community members to be able to scan their products. And I can put a link to a pamphlet that we have that lists some of these apps. Yes.
So they followed up with, can you share the other apps, please?
Yes,
So,
I will put that
okay.
link in.
And those
Okay.
apps, everybody, I've tested them. I have 3 daughters. I've tested them. They really work. So if you scan the QR code on the back of some products, it'll give you a list of what's in that, and it'll highlight. So you won't have to go looking for it. It'll highlight which ones are actually harming the body, the community, and so forth. So I encourage you to use them. They're very important. Share them with your friends. If you have daughters, loved ones, nieces, nephews, please share those because it'll help out.
Yair, did you want to add something, Yair?
Yeah, hi guys, sorry. I don't know what you guys can see me. Sorry, I'm trying to keep a low profile because I'm making enemies. Yeah, I think the app is fantastic, the Yuka app, and I think we need to spread the word. I don't think a lot of people that I talk to don't have no idea. And you'll be shocked at the list of chemicals and some of the things that we grew up using, thinking that they were, I mean, they were probably better before, but I don't know what happened in the last 20, 25 years. So if we can do a campaign, I guess, to spread the word about these apps. So now I'm like sending in Target or supermarket, like literally scanning stuff, even food, and we should have the food ones too, because there's food apps as well. So if you can share the other apps, because I use the Yuka, but I know there's other apps, and sometimes they don't have food. Some of the items are not there for food, but we need a food one as well. So that would be great because we will be shocked at the stuff that we've been putting in our bodies and using.
I had a question in regards to the apps, right? And the reliability of these apps, because these are free, but you know, we don't know what happens in the back end. Sort of like when you go to Google and you search. It's a free search, but they're monetizing your search, and you're gonna get a list based on advertising. So how reliable are these apps? How truthful are they? And how much can you trust them with some of these products that they might rate a certain way? But you have to be a chemist to understand. And then the parts per million that will take for it to become, harmful. So, Dr. Martinez, can you help us with that?
Yeah, I think that's a really, really great point. So for instance, I'll just use one of the apps as an example. It's called Think Dirty. And that app is a highly monetized app. It's good in that like you can go and you can scan products, but it takes a lot of money to keep up with these databases in the back end to have all of these products in there. And so, yes, they can, they'll push certain products up to the front, like, how about you buy this other alternative? This is one reason that we act, and actually one of our partner organizations, Breast Cancer Prevention Partners, are now talking about creating an app of our own, where essentially it's not going and scanning barcodes, but is literally reading the ingredients list on a label and then popping up the health information about those ingredients that are shown to be toxic. And it's one of the things that, we shouldn't have to have a PhD in chemistry to like understand the toxicity of a chemical, or of a product. And so that's something we're trying to think really carefully about. How do we inform people to make health choices for themselves and keep it really simple? And also just, for many of these things, the safety studies really haven't even been done to know like exactly what dose you had to have particular health outcomes. And so also pushing hard on the federal government to have more regulation around some of these things. But yeah, right now I haven't found any perfect app, but that is something that we're working on.
Thank you, because that is important, because, you know, folks are going to use this app, make decision based on these apps, but they're not realizing that on the back end, there is a prioritization that takes place, and there can be a conflict of interest. And, you know, we need randomized control trials. So then we can tell you, hey, this is what was found. And then with that, you do a meta-analysis, which is you compile all that data so you can see the results. So these apps are good, but take them, you know, take that information and understand that there's also another aspect to having these apps that are quote unquote free.
Nothing is free, man. Nothing. We all have to pay a price.
Let me see if there are any other questions. Let's see in the chat, there are several. Okay, Dr. Martinez has put her educational booklet in the chat and her contact information. And so if that is it, we will move on to our next topic. Edwin, did you have anything else you wanted to add to?
No,
Beauty Aside?
th-
Okay.
Thank you for the presentation, and thank you, Louis, for always advocating and helping us, you know, look at the environmental aspect. And we are at war with big corporations who are trying to, you know, make more profits. So thankfully, we have organizations that are helping us digest a lot of the stuff that's thrown at us. Because when you go to, you know, Target, I mean, it's incredible all the options that you have.
Well, thank you so much, MCB9. Laquita, anytime you just say yay, I'm here. I'm always here to the meeting. So whenever you need me, Dr. Torres, CB9, I'm here for you. I'm your representative.
Thank you so much. And we probably, we do
Okay.
have an upcoming topic. I'm not sure if you'll be ready for it today, but you know, we've already approached you about a water situation, but hang in there with us because I believe there are a couple of things that are coming up.
Okay, I think
this
Dr.
evening.
Martinez had one other comment. Go ahead, Dr.
Oh,
Martinez.
yes, I just wanted to flag, I just put in the link in the chat to the Black Beauty Project. And this is a project that we're working with a big group of collaborators to highlight Black-owned beauty brands that are non-toxic. And so next time you're going to do some shopping for personal care products, that's a really great place to look.
Thank you. Thank you again. It was really terrific. Now our next topic in the environmental category will be presented by Basha, a former Community Board 9 member. Basha, take it away, give your complete name, and I didn't want to mess it up, your last name, and why you're here.
Hello, everybody. Thank you very much for allowing me to join and to speak at this meeting tonight. I really appreciate it. As Laquita said, my name is Basha. Formally, it's Barbara Nicanoro. I'm a resident of Community Board 9. Like she mentioned, I served on the board a couple of years back. I co-lead with Michael Palma, the Montefiore Park Neighborhood Association. And on my block, we started a block planting day more than 10 years ago. And that is sort of the origin story of what I'm here to talk about, which is this children's book called 17 Trees to Be Precise, which was sort of a conclusion or a search for finding a 10th anniversary celebratory something that we could share in community, but also potentially, ideally, use as an educational outreach tool to share more broadly beyond just our very local confines. So, sorry, my dog is bagging at the door. So basically it's us, I'm sorry, I'm just gonna open the door because he is going to be.
I know, I've been dealing with that kind of thing all evening.
So it's a children's book, which is, and I'm here because I thought as a health and environment committee that you might be interested in hearing about it. So thank you. It is a book, it's a children's book for ages 3 to 8. It is illustrated by New York City artist Juliette Borda. I think phenomenal illustrations. And it is basically about highlighting the value of trees to people and to the environment, as well as the value of community engagement, how it kind of changes a community for the better. So it's divided up into like it's got three areas, right? So the main one is this sort of rhythmic story about reforesting a city block. And that's loosely inspired by our 137th Street block planting day. And then there's a spread, a 2-page spread that includes this very synthesized, it highlights 10 synthesized tree benefits. And it's kind of in the one hand described in shorthand so that, you know, if you just want to kind of get through them, you can. But also there's a little bit more text. So if the kid is really interested or if the caregiver is really interested, then you can also dive more deeply into that specific benefit. And then there's the third part is that there's a spread highlighting, again, in a really kind of trying to make it as welcoming and easily to digest, kind of 8 steps to start organizing if you had a great idea to implement in your neighborhood. And that's where the book kind of ends, right? So it was crowdfunded. And on, I don't know if you're familiar with this phenomenal platform called IOBY, highly recommend. If you don't know it, check it out. They specifically focus on environmental and community projects. So this was like a great home for it to be. It also received a couple of grants, a seed grant from City Parks Foundation, which more importantly than the funds was actually the graphic support that they also offered with the phenomenal Anne LaFond, and a grant from a matching grant from Con Edison and a matching grant from New York State Department of Environmental Conservation. And finally, from the New School, the Tishman Center, to support the Spanish language version, which I am like, that's probably one of my most satisfying elements of it. So the first edition, because of this crowdfunding, I'm able to separate, to reserve 4 Community Board 9 copies, complimentary copies that could go to Community Board 9 daycares, schools, and libraries. And besides that, Partnerships for Parks is also going to be distributing, they purchased some additional copies and they'll be distributing them throughout the city to volunteer groups, to park, you know, they work with friends of groups from parks. So they'll be distributing in that way. So it's also going to be available to, you know, entities if they're doing events that are somehow tree related or civic engagement related at schools or museums or, you know, back to school events, that kind of thing. So I'm eager to just get it out. The idea is that it serves more of a kind of an educational outreach tool rather than, it's not a money-making gig at all. So I will drop into the chat my contact information. I encourage you, if you are interested, to follow the book on Instagram, which is where I'll eventually post information on how to purchase it. But please feel free to reach out to me if you believe that you may have some great synergy to kind of let it to live in some area or some community or entity, office, building, whatever, that you know that could use it. So, and it's—
Thank you, Basha, for the presentation and for the complimentary copies for the donation of the book. Now it's coming out in the spring.
Yes, so I have with me 2 of the final proofs, which is very exciting. And yeah, it should be ready later this month is the plan. And it'll be first released on the block planting day on 137th Street. And I'll have some copies as well reserved for Community Board 9 as well.
And you should reach out to the Education Committee as well, to speak with them. And they may be meeting next week, maybe their meeting, date.
Yes,
I don't have the exact day of the week, but you know how to make that contact.
yes.
And,
I'm in
and just let us know so that we may have ideas as to make sure we reach, you know, our daycare centers, as you mentioned, in our district, the libraries, schools, particularly grade schools. Okay. Thank you. Any questions, anyone? I see.
No, I would just say that this sounds like a great project, especially, you know, for kids to start to think not only about the environment, but also become conscious about their community and how they can contribute, because there's so much out there, you know, a lot of negativity, but this really spins, you know, things for the positive.
That's the hope.
Yes.
That's the hope. Thank you. Anyhow, I invite anybody to contact me. My email is there, and thank you for this opportunity.
And you dropped it in the chat.
I
Okay.
did.
And if everyone would just hang in there with us a little bit more, we have a rundown on activities that we've been part of or led, and we need to give you follow-up and we need your feedback. So the first, Dr. Torres will give us a brief update on the auto body shop complaint. There was a resolution that was presented, but we did not vote on it. But he will bring us up to date on what has transpired. Dr. Torres?
Yep. Thanks, Laquita. So we had a walkthrough with the community board. We had our chair, Barry Weinberg. We also had the Uniform and Services Committee. We had the Department of Environmental Protection,
The
join us.
sanitation department as well?
Sanitation wasn't there, but we had Lyle from the Department of Transportation, from DOT. And we did notice that there were several violations in regards to cars parked. There was also a car cleaning operation that was taking place. So this business is using their license and extending it to a car wash. And we were able to smell the fume that folks are complaining about. The good thing is that since we had DEP present, they were able to take notice of that. And they did give some homework for the community, for those who live around there, to take pictures and videos of the operations that they're doing when they are spray painting these vehicles, which, it has to be done in a confined way. So there's more to follow with this, but the community board was able to see the complaints that folks brought to the community board.
So we have a resolution. We don't know. Can you give us information on where that stands and if we'll introduce it next month, or
So
what's your
we did.
thinking on
We
that?
did have. We had a resolution that we wrote about this, and we can bring it to the floor again next month. That will give us a little more clarity as to what DEP finds for the next 4 weeks. And also DOT. DOT is taking care of the parking situation that's happening there. But as far as the environmental aspect, we did write a resolution that was introduced, I believe, in February.
Yes. Mm-hmm. And we held off and then we met with UST. Yes. Okay. All right. So stay posted. We are a very active committee, and thank goodness we have a lot of support from our members, participating members. update on the Grant Houses water complaint. Carlton Davis, who is a member of CB9, reached out to us to explore his issue. And so we brought WEACT into that discussion as well. So Carlton, can you give us an update, please? We might have to give a teeny bit of a backdrop, but if you take a moment to give us that and an update, we'd appreciate it.
Yes, in Grant Houses, numerous apartments are suffering from water, not just water damage, bad pipes, all kinds of brown soot, goo in their water system. I have a few water filtration. So around February 8th, after contacting NYCHA, I contacted Victor and Barry at a general board meeting back in February, and I, let them know, what was going on with our water, because they are familiar since I was TA president for 7 years, and wrote tickets for everybody, created a resident response form. We wanted to find out why are we having this kind of water issue when you cleaning tanks and the water's out more than it's on. So I had checked my breeder one time, and it was all this dark brown goo and looked like little round metallic, I don't even know what to call it. It looked like little tiny round metal.
Debris.
Yeah, and you could clearly see it in the photos for those who had the photos. So, we talked about it was the orator and stuff. We went back and forth with NYCHA, closing tickets out, claiming that there never was no history of tickets. From a 7-year General Grant TA president, I don't know how to do tickets? Come on. That's typical NYCHA. But anyway, as we pass through, with the sink and the bathrooms and stuff all being clogged up and everything, between February 8th and now, we see clarity in the water. So last week, Thursday through Sunday, the water was off and on. And I guess they were cleaning or whatever they were doing. And then we had another 4 days. This Thursday till Sunday, the water just coming back on to a regular now. And I removed the breeder filter and checked the aerator. There's not that much gook as it was when I sent it in the same 30-day period, and but it's something that we got to watch out for. It's just a lot of problems we've been having with piping. So the reason I'm making this an issue is because there's over 5,000 people here. We have 1,940 apartments. This is a big place, wide body, 11 apartments on each floor, and they family apartments. You only have 20 bedrooms that are 1 bedroom. Rest is 2 bedrooms, 7, and 3 bedrooms. These all the way down to the second floor. First floor got 4 bedrooms and so on and so forth. And there's been this problem with the water. So my concern was not just it coming out of my house, it was coming out of other people's houses too. Because people was saying when we was talking about it, when they shut the water down over this weekend, how their water, looked it bad, and everybody don't have breathing. The filtration. My water is filtered. It go through the system, and I get fresh, crispy water. Everybody don't have that. And that's my concern. Suppose I didn't have it. And that's my concern.
I'm sorry that Lewis had to leave, but I had emailed your follow-up. No, there was something you asked in terms of the Hudson River and mercury in the Hudson River. We'll have to have some discussion about that next month. But I did forward that to Lewis. He was to get back to us. I know that you indicated you were not, this was a month ago, not satisfied with the response. But it seems as if you've moved forward, and the lifesaver seems to be not only your BRE system, but apparently they might have been listening because they were doing something, and they were probably trying to check it, but not let you know that, yes, you may be right, you may be correct.
Yes.
I don't know if anyone has any other suggestions. That's what I asked for from WEAC, how we should approach this. I know in terms of NYCHA, there are a lot of maintenance issues.
Well,
But this is a health and environment issue as well.
Mr. Davis, quick question. Are
Yeah.
any of the electeds pushing the agencies, not only NYCHA, but the other agencies such as DEP, to help with this water crisis? Because I see it as a crisis.
Yes, I don't think it reached that level. What happened is, like I said, I was a 7-year president before this team came on, the superintendent and new property manager. For 3 months, we had to run grant. The tenant association had to run grant until they came in because the old property manager was removed. So, we had this problem for a long time. So between 2015 and 2017, as TA, I created an impressive mark of 47% of repairing pipes. And we had renovation going on as far as, busted pipes in your kitchen and your bedroom. They will replace cabinets. You get a brand new wall. You got a vertical metal mesh instead of the horizontal wire mesh. So we had progress in those 3 years, 15 to 17. And you had fresh bedrooms, new floors. So your apartment was partially renovated. So this is happening in apartments. I think this is wave 2 of pipe disasters, because just last year, 2021, actually, the end of 2021, we had a massive flood in 1305 that shut down Jackie Robinson Community Center. So we've been having this water issue. Come on, we need the other 53%, done, so these people, can live without being flooded out of their apartments. And yes,
should we do a letter of support for some action there? What is the committee's thinking? Or should
That's
we?
a good idea. That's a good idea.
Well, I just want to state, before coming to CB9, all that know me know I'm a hard nose when it comes to my senior and families. I think about the seniors, automatically, and everything else kicks in. So I've been pushing hard. Even as president, I favor no one. And, I'm with CB9 now, and it seems to be, oh my God, we got to watch out for Mr. Davis, because now he's with CB9, he's with the board and things of that nature. And he has people who he can contact that are in the field and on those committees that can actually take an in-depth look. And it might start there, and then we have to look out the outer perimeters if it's possible.
So it seems like, in addition to what Edwin has mentioned in terms of DEP, and of course to NYCHA, maybe a letter of support can outline, we'll need your help to outline what's going on and say, look, and also some phone calls, because the water issue is a very serious issue. We don't want it to get any worse.
Well, St. Nick had a problem a few years back with Legionnaire disease at St. Nicholas houses. And they had to get out there and get things done. People were sick, and I think you have a possible death or two that was there. See, it was the highest rate of COVID deaths, and people and we battled through that.
Now.
We had 9 months of that pandemic in 2020 where nobody came outside but my team. We was out there giving fresh food, telling people, you know, pick some soups and stuff. We was giving out all kinds of packages. The military came, was dropping things off. Robert Jackson was involved. Brian Benjamin during that time was involved. Sean Abreu, Congressman Espaillat, all of them came to Grant, and we cleaned it up. They gave me the support, and I got the people, the teams, and we went and we cleaned. Grant is cleaner than now, but we still have the pipe issue. So I'm giving you an outline, a short outline on how when you walk through Grant, you know, the workers are working, maintenance work, the grounds crew, you cannot really say anything about them. But it's the inside that is the problem. You know, it's the interior problems that we're having, and it's basically the rest of the water piping. As I said, it was about 47% on the calculation, even with NYCHA. And it was a good job, Mr. Davis, you know, blah, blah. But we got 53% more that needs to be checked and done. We still got buildings that are absolutely flooded. And then you got water that cuts off for hours. Kids don't have no water to even bathe in the morning. Got to use spring water to douse on the kids, and you know, I mean, it's all kinds of events going. And I don't mind writing the outline of it. Like I know this place like the back of my hand, you know?
If you would do that, that would guide us, and then we'll see where to go from there with this, and state very specifically, since there's a lot that is being done there, but where it's critical for them to speed up the process and do some investigative work. Okay.
Yes.
If you can get something from you, just bullets or other this week, then perhaps we can begin to work on some kind of letter or other.
That would be great.
Any other feedback or suggestions, comments related to this issue?
Yes, I have a question. I've had my hand up several times.
Oh, I'm sorry. I just saw it, Heather. Go ahead.
Carlton, have you all requested test water kits? Have they presented you all with those?
Well, I'll be honest, I had linked up with NOAA, if y'all familiar with it, the National Atmospheric. Have you met them?
I think you can through 311 or Humberto, who's our community, I guess, community
DEP
advocate
person.
from DEP.
Yeah, Humberto Galarza.
Yeah, I think that you all should just bombard the city with test water kits and send them in because once you have the data of what's in the water, and how unhealthy it is, then that's going to force them to act.
Yeah,
but those test water kits are free.
Yeah.
Where do they pick those up?
They will. I think they'll mail it to you.
I think to follow up on Heather's, to have that information is it will just accentuate what you've been saying to us, and make any letter of support even stronger. So have everybody call 311 so they can get their kid, because they send you a kid and you get the water and send it back to them, and then he'll tell you if it has lead in it too.
Right. If they get 1,000 of those, you said it's a lot of people there. I mean, the city will be forced to act.
That's a great suggestion. That's great.
Yes.
I mean, it sounds that way to me.
Yes.
What do you think,
Well,
Carlton? Can you get a letter out, a flyer or something and then follow up, get a team together?
And you don't need 1,000 folks to call, right? If you get 5 or 6 samples that there's lead within the building, then you have enough evidence, because that water is traveling to everybody in the building. Now, it would be nice if everybody can call, but that can be a lot of work, Mr. Davis, for you to try to get everybody to call. Get a couple. Because once you get a couple, then the city's going to have to act on the other units to make sure that they're not being contaminated.
Right.
And
just
Nitro's
put a
had
flyer up
problem
in
with
your,
lead for a long time. I'm sorry, Heather, go on.
No, I was just put a flyer up in the mailroom or something like that and just let people freely. If they want to call, fine. If they don't, fine. But you probably have your core people. Make sure your core people do it so that you can follow up appropriately. But we need to act on this, and we need
Yeah.
the data.
And it's important that they come back to you so you can then, say unit X, came back with that, and then you can have those numbers, because it's no good if they get the information and they don't present it back to you. So then you can bring it, and we can, say, look, they tested 50 units, 47 of them came back positive for X, Y, and Z. This is the problem here.
Right.
Yeah. So do that, and so we'll work on a couple of things simultaneously. I like that idea with the kits, because that's data. That's concrete data.
I was stating earlier, we had worked with NOAA, the National Oceanic Atmospheric Administration, and we had the air quality in here because the one ventilation in the hallway, and we was working on this water situation where you can test your water. So yes, we were on that course, but I would have thought that with the new administration here, that they will be keeping people informed if anything wrong, plus the residents speaking up. So I'm not sure if they have been speaking up in a large numbers, but I know when they see me, I get a lot of people who talk to me. We'd be 7 of us in the lobby before I can even get where I'm going, talking about water and other smaller problems that they have. So yes, I will follow up. I would definitely, this will be something that's passionate for me,
Yeah. Yes.
Like
It's their home.
yeah, I was right. I'm on the community board now. Plus, I live here where there's a situation that's we don't know how bad it is or anything right now.
Thank you, Carlton, for that update. So you have your work cut out with you, just in terms of informing people about the kits and getting some kind of flyer up, and then enlisting other people to help too. But you can determine what would be a good response number, but just 20-25 could be good. Not even that many, as Edwin has suggested, possibly even 5. But do that and then get the bullets, the notes to us, and then we could simultaneously be working to help resolve this issue. But NYCHA has a long history of lead. I remember that coming up in the health committee a number of years back, and it's been reported in the newspaper. So it's just not resolved. And that's a serious issue for our children, for our people, in that development. Thank you again. And now another community board member, we have an update. We're happy to have Miriam Aristide Ferrer here, and not particularly for this reason, but she can best report on it and give us an update on this the nauseous building fumes that we think are coming from 3609 Broadway, next door to your building, and impacting a couple of other buildings.
Yes, thank you. Hi, everyone. Good evening, everyone. And I just want to say thank you for connecting me and helping me address it I think it was last Friday. It was last Friday that it was really, really bad. And it was making me sick. It did stop. I did receive an email from Umberto. They closed the ticket. And I received a call from an Inspector Robles. So I have his cell phone number if it ever happens again, to call them immediately. But this has been a situation that's been ongoing. I've been reporting it on and off since 2009, 2010.
Wow.
There's reports going back that far. Our building did put an air monitoring device and did test, and it is toxic, and still nothing is done. It's a pattern. every, when it's the change of season. But this was something like I've never experienced. It was just like an exhaust fume just blowing into the courtyard and into all the buildings for over 8 hours nonstop. I was sick. I got sick last week. My throat was sore. My child had headaches.
Oh,
I
no.
wasn't well last week, and I don't doubt it was that. So I don't know what to do. It was stopped for that day.
You say
You
it
know,
was stopped, like the building.
Edwin gave
super?
me Edwin gave me a text, the text of the super, and I text them and said, "Look, we're reporting you." You know, I went up to my rooftop and I filmed the fumes. I caught it on film. You know, the DEP has come out here numerous times. If they don't see it, they don't believe it. So we play this cat and mouse game.
Mhm.
So far, it's been good the past couple of days since Friday, but since last week, but last week was enough. I mean, when it happens for one day, it makes you sick. So you know, I don't know what to do at this point. Our building has taken it on at different points, different times. We've had inspectors here. We stopped it last week, but that's basically it, you know.
Marion, it's interesting that when you contacted the super, it stopped, right?
Yep.
Because
Mm.
it seems like, you know,
They know what they're doing.
indeed, the parties involved, they are able to, you know, turn on and off this, you know, whatever condition that's taking place. I'm concerned, honestly, because, you know, what health, you know, risks are the tenants,
Yep.
you know, in your building
Yeah.
being exposed to. Let's
Yep.
remember that when people smoke, it doesn't show up. Cancer doesn't show up tomorrow. It can show up over 20, 30 years. So 12 years with this issue and having to spend money on it, this is concerning. And,
Yep.
you know, we have, the catch
What's
and
more concerning here is we own this apartment. We put all of our life savings into buying this property.
And the problem is next door to the property.
And we know what's causing it.
Yep.
Okay.
What are
We have a
what is
report.
it strictly the kind of oil and it's the exhaust from that, or what is it?
It literally smells like the exhaust fumes of a truck when it's happening, and we have HVAC systems in the building, so it goes right into the apartment. It literally enters my apartment. It's absolutely poisoning when it happens. When I called you guys, I was desperate. I was literally on the street. I couldn't even be inside my apartment. I was outside, like I went to the other building. I went to the rooftop because I said, I can't even work. I can't function in my own home.
Wow. Monique?
Oh, sorry. I'm sorry. That was a question. I was asking, do we know what's causing it? And Miriam, I think you said you did.
It's
But there's no-
3209 Broadway, and this
32
landlord.
or 36? 3609, right?
3609. They have
3609.
a long history. Every building they have Alma Realtor. Every building they have in this community, they're a slumlord. They don't care. They just don't care. This isn't the only violation they have. They've been reported. They get violations. They just don't care.
The city is actually suing them for the building on 140th and 141st, the one right on top of the Grange. They're being sued for that building. They're being sued for the building next door. I think that, you know, with Miriam's situation in her building, we should have, you know, the entire board come up with a solution, because 12 years and we persist with this, you know, for the purpose of transparency, I'm the president of the Hamilton High Tenant Association. We have fought Alma on many, instances, fighting for humane living conditions and making sure that tenants, they get, what they're paying for. So as a community board, I think that this is even bigger than just health and environmental. I think that we have to, have the city come out, see what's going on, because you have the testimonies not only of Miriam, but all the folks in the building.
And
And
I
it should
want the
be done.
community board to be aware that this is a new development in the community. This is on 148th Street between Broadway and Riverside. These are market rate apartments and we are defenseless. We are in the same position as if we lived in one of those buildings. I literally moved out of 603 West 140 on 137th Street, a pre-war building, because my son tested positive for lead. And I literally put my
remember
life
that.
savings into a new development to be safe.
Right. Mm-hmm.
And here I am, 12 years complaining. I was on the board of this building. Like we have paid for private monitoring. We have the results. We've come to this community. We come every year because this problem happens every year. And what can we do?
Is it one particular time or is it every month?
What I notice is when it's a pattern when they're turning off, like it's usually around this time of the year when the permanent boilers are being turned on and off. It's something like when they're switching from winter to summer. Usually in that transition, there is just toxic fumes being emitted.
Wow.
And then randomly in the summer, it happens.
I mean, it is an anomaly, right? We have so many buildings in the community. How many have come to the community board to complain about this issue? Whether you are a market rate, whether you are stabilized, whether you are in any other type of housing, how many of the buildings are coming to us and saying, look, we've been dealing with fumes for the past 12 years, we need help. So, we have heard this issue many times over the year, I would say the past 2 or 3 years. But this is something that, I think it requires, the city's attention.
We probably also should join with the housing committee.
Yes, absolutely.
I'm not sure which other committee might be. Maybe uniform services again might be part of
And
this.
economic development, right? Because folks
Yeah.
are invested in this community.
I was gonna say economic development.
Yeah,
Uh-huh.
we should be, able to, everybody deserves to live in peace in this community. And if this was south of 125th, we see the response. Just because you live up here doesn't mean that you want to live in substandard housing conditions, because that is a perception that people have. That
Exactly.
Black and brown
Agree.
folks don't deserve to live in peace and quiet and in an environment that is free of toxin. So, we have to, address this issue.
Actually, it seems
I
like
appreciate it.
probably one, I don't know if it's a resolution or a letter of support, but it seems like dealing with toxic situations, probably the grand houses issue, the Alma Realty issue might be along the same lines, even the auto body shop.
I would say that
or maybe just the two, the grand houses and I don't mind them being separate, but it's like one big issue of dealing with toxins.
Right,
in our community.
environmental issues.
Environmental toxins, yeah.
It's affecting the quality of life.
Quality of life, exactly.
I agree. And I have to say that I've you know, in the 12 years of digging into who addresses this, I know at one point I found out that part of the issue with dealing with air pollution and air quality is that there is no direct funding for it. The DEP is funded by the water board. So there's really no one, there's no agency, there's no agents, there's no protocol specific when you have air quality problems
Exactly.
or
exactly.
resources, because it's mostly water. It's, you know, they're more focused on water, which is even more alarming with the Grant Houses concern. You know, that's at least funded by the water board, but air is completely something that the city and state are neglecting.
And I will echo Miriam, the same goes for noise.
Agreed.
So we need to, sounds more like we need to come up with, we could possibly come up with a big resolution and
We
get.
wrote a resolution about this, Miriam.
I feel like we
I
did.
remember we did when
You probably-
there was a doctor in your building.
Yes, Zoe.
Yeah, Zoe came and
yep.
presented. We wrote a resolution. I think, Laquita, we should bring this up in executive because there was a reso already written on this particular issue.
This is an old
Okay.
issue. This
Yes,
is
this is an old issue.
old.
Yeah, so I just don't want to keep writing resos.
Yeah.
And here we're going to be 3 years later talking about the same thing again.
Right. It sounds
So
like it
I'll
needs to
see about looking
escalate.
it up. I wasn't, I guess I was on the committee. I don't know. Do you know about what year that one was? Was it?
Wasn't it last summer when
I think-
Miriam came and shared? May or June, I thought.
I
think
you were,
we can look through the emails and see, you know, just.
but
type
it's in the
Zo-
last
Zoe.
3 years. You're saying
Yeah.
within the last 3 years. Okay.
Yes.
Okay.
Like, I'll be more than happy to write another reso again, but I just don't want that.
Or
to
we
just-
might add to it, but we need to bring it
Yeah.
up. You're right. We could easily add to it. What were you adding, Monique?
No, I was
I
just
thought you-
saying that it sounds like it needs to be escalated for sure, because it's not being properly addressed. So that's what I was wondering, how do we escalate it to the next level?
Yeah, I still see kind of visually or picture the whole, just as environmental toxins in our community brought on by negligence from our landlord negligence.
Right.
You know, the water complaint, the at Grand Houses, because it's more than water, it's the pipes, you know, slow maintenance that we don't know, again, the impact of children and all there is still affecting our lungs.
I think Laquita, I want to second what Laquita's saying, because it seems like we are in a housing crisis, and then on top of that we have landlords who are absolutely negligent. I mean, we have the whole, you know, the displaced, you know, the families displaced with the fires, and, you know, the negligence on behalf of those landlords. Like, what are they doing? Are these people even going to get into their homes? Like, there's something going on with housing that
exactly
it's just
It's
nobody cares.
It's an infrastructure issue.
Yeah.
And this is why I fight against increasing density of housing in the city, because it's making the situation worse. And increasing density anywhere is going to negatively impact the infrastructure around the buildings where we live and own.
Mm-hmm.
It is an enforcement issue of the existing laws.
It's an infrastructure issue.
Well-
We live in an old city.
It's
Yeah.
both.
It is both, you know,
It's
these
both, yeah.
landlords, when you look at the building that went up in flames on 141st, the landlord gets paid, he will get his insurance money. Now he doesn't have to deal with those rent stabilized tenants. So look at a 3-bedroom apartment, 2-bedroom apartment in this community is going for $3,000, $4,000. Their hope is to delay the construction so those tenants can go somewhere else. And many of them will. That's what happened on 145th. 145th and
It's
Broadway.
criminal. It's criminal.
Broadway, that is precisely what happened. Families, they relocated somewhere else. They were there for X amount of times, and many of them were offered money so they don't come back. So you know what? You're living now in Queens, you're living now in the Bronx, you stay in there, they bring $50,000, and you're like, you know what? Forget it, I'm not coming back. This is engineer. This is what happened in the Bronx when, you know, buildings were going up in flames. Now we're having a different issue where it's happening, and when it takes place, they delay it as much as they can in hopes that people will go somewhere else.
Well, let's regulate the construction industry. It's too expensive. It's very expensive getting repairs done.
These guys, money is not the problem for them. They're delaying it.
Money is a problem.
They get the insurance money and they hold on to that money so they don't fix the building.
How do you know that? How do you know how much they're insured for?
I see it with different fires. I get to speak with these folks. We get to see what's happening with the landlords, and they delay even the entry of the tenants to try to get their stuff back. The whole process is delay. You're not talking, you know, when you speak about these guys, Heather, you're not talking about, you know.
I'm talking about the landlords have to depend on the construction workers to do what they have to do. They have to depend on engineers. They have to depend on dishonest architects. It's just not the landlords. It's a whole network. It's a whole infrastructure issue.
Let's define these landlords. You have folks who own 1 or 2 properties. And then you have the mega landlords who own hundreds of buildings and have their own architecture firm within their company. They have their own law firm within their company. Alma Realty has their own law firm. They have their own bank. It's called Alma Bank. So when we speak about landlords, we have to define who we're talking about.
Thank you.
This is a big issue. So what I suggest is that at our next executive that we, because of the issues we're facing, we can try to find the Zoe resolution from several years ago and say we have this, and now and indicate that our problem has expanded. More and more we are faced with environmental issues of environmental toxins, and that we need to act on it. And perhaps at that moment too, with what Carlton, which I'm hoping Carlton will present over the next few days, the information we have from Miriam tonight, as well as reference to the Zoe, we can craft a broader, more in-depth resolution because the situation is greater.
And I would mention, Laquita, to this, that the new phenomenon that's taking place in the community is that you're having in these buildings where the apartments are rented, the entire apartment. I'm not speaking of tenants that they rent a room and they hold the lease. The entire apartment, even the living room, is being rented, and you have multiple folks living in a unit. Folks who have these lithium batteries. You know, I have an apartment that has at least 10 lithium batteries charging every single night. So it is a problem of enforcement. It is a problem that when you call DOB and you report these issues, they come back and say, well, they didn't open the door, and they close the case. So we're gonna wait until the apartment goes up in flame, and you know the landlord gets their check, and then the tenants are in the streets.
Right.
You know,
Well, tell the tenants to stop bringing those bikes into the buildings.
But you know, these are folks.
That's not the landlord's fault. That's the tenant's fault.
Heather,
They
we
shouldn't
have,
be bringing them, you know, and
Heather,
then if the landlord says they're not allowed in the building, then that's a problem.
Heather, we have information from some landlords in the community that they are themselves running these operations because they make more money this way. Not one person hold the lease to that apartment. And if you want, we can sit and I'll show you the videos of their folks that go and collect the rents for each and one of these units. So we're having an issue of enforcement. The tenants are calling about these problems and DOB is not following up. Talk to the folks on 141st who had their apartment go up in fire and see the issues that they're facing with their landlord right now.
Mhm. And once we have this resolution, not only do we need to.
But that means, but I'm
oh,
sorry,
let me
Lakita,
just say, oh, go on, Monica, go on.
that's an HPD problem. Because essentially what they're not renting out apartments, they're renting out rooms. And in order to do that in a building, that means that you have to change the status of the buildings. And there's all these things that you have to do. If you're gonna run, and they're not doing it. So they need to call HPD. They also need to call, what's that, Housing and Community Development? HCR,
DHCR, but
yes.
DHCR, you call Monica if you are the leaseholder, right? And you want to bring up a case about not, you know, an illegal rent overcharge, but you hold the lease. These units, everyone who's in there, they don't hold the lease to the apartment. So when you call, this is a DOB issue where DOB comes and knock on the door. These folks have been told, do not open the door.
No. This is an HPD problem.
No,
This is,
DOB
yeah.
answers SROs, not HPD.
I understand that, but this is an HPD problem because these buildings are not listed as SROs. They're listed as apartment buildings.
Yes.
And that's the problem. It's not really a DOB problem.
It's not. It's an HPD code enforcement problem.
Yeah, exactly. That's what it is. That's what it is.
Which is HPD
I think that
code.
I think at the end
Code
of the day,
enforcement.
I think at the end of the day, no matter if you're a renter, buyer, or if you're just renting a room, I think as a community board, we should really be careful about, you know, like, is it this agency? It does not matter what city agency. City employees, I was a city employee, we should be held accountable, and we're not. We see that with the politicians, we see that with supervisors, we see with Department of Buildings, when they're doing, you know, the surveys to see whether a building is being properly constructed. They look around and they say everything's okay, but then they're getting a bribe. We see we see that.
Yeah.
It is not just one single problem it's for everybody.
Yep.
I think we need to, if we need to write resolutions, we write them, but at the end of the day, we need to be every single city agency. It does not matter if it's transportation, because we see that with the fumes with, you know, illegal parking. Department of Health as well, you know, where is the Department of Health?
Right.
They have a division of environmental. Why are they not speaking with the colleagues with Department of Environmental Protection? All that stuff.
That is very rude, but very true, Patricia. I just sent Laquita today. We passed a resolution here about the fumes and trucks, and the issue is just gotten worse. You know, not one ticket to any of the trucks parking in our community. And
actually, they sent a note back saying, or an email saying, well, we went there, but we didn't see a reason to give them a ticket. That was one of the responses.
And it's spelled out in the DOT that no commercial truck shall park in a residential area. Besides the parking, each one of us are clearing that nitric oxide from those trucks, when they turn them on in the morning, trust me, they're not just turning them on and running away. They're turning them on, they're letting them get, warm, and then they're moving, and they're moving through our community. They're not in a depot. Everybody went up in flames about the depot on 145th. We're having a depot here scattered all over the place.
Mm-hmm.
And no enforcement is happening.
Yeah.
So this week, they're going to have the Uniform and Services Committee meeting. I would encourage you guys to attend for the discussion about the environmental part that
It's Thursday,
Thursday at 6:30.
April 6th.
Yeah,
April 6th.
this week at 6:30. In regards to the fumes and trucks, I will be bringing that up to them. And they just have to do their job.
Yeah, I think it's a big issue, and I think we ought to have just one big resolution and then go after and list every. I agree with Patricia. We list agencies that we want to have the information, but it goes to the mayor's office. It just has to go everywhere because our community is getting shafted, and then we're walking around, brain fog and everything else because of fumes. That may not be identified
even cancer
until later.
I agree. And like this, I just want to say the summer's coming up, and the ice cream trucks, for example, they idle right next to the schools. Like there's a truck that parks by PS 153 on 146 and Broadway, right at the crosswalk, and it's toxic. But nobody says anything
because they want their ice cream.
But it's horrible, and they do this around the school.
I'll invite everybody to go to the Upper East Side. I used to work in Lenox Hill. This would never happen in Park Avenue in Lexington. Park a truck and leave it there for a half an hour, and you'll see that truck being moved overnight. So we do
because
have
the food trucks. Let's say the food trucks by Wild Cornell, they're there, but I don't know. I can't recall if they're running or if they're idling. I think that they have their batteries and all of that to operate whatever kitchen they have, but I don't think fumes are an issue.
In Carnegie Hall, these trucks, they try to be there because of the shows. They removed them faster than what they were able to park. They started ticking them nonstop for the fumes. So you have a tale of two cities. We're not telling the agency that enforce some of these parking regulations to stop, their critical, situation. But I have seen many times folks just standing around, sitting on their phone. Meanwhile, they're just sitting right in front of these, vehicles. And this is a permeation that's happening with all these other agencies. When
Yair has her hand up. Hurry, Yair.
Can you guys explain to me? So you guys write the resolutions, and then what happens after you write the resolutions? And what's the process? What's the point?
We've been following up with ours within the ones that we've put out within the last 4 months. That's why you're hearing about them today. But so we've been providing updates. We have not done one for what we were just talking about. So what the plan is to look at the one that was recently, well, I say recently, within the last 3 years done, related to Miriam's building, related to fumes, because all of these problems seem to interconnect in terms of air quality. And then just do a large resolution.
But then once you guys do it, what happens? Where does it go? So you guys write it.
It goes different places depending on what agency we think is involved. That's the only thing in terms of what Patricia was talking about. We do have to list the resolutions, but that doesn't mean that other agencies are not, if there's action, those other relevant or relative agencies will be contacted. They'll be part of the loop.
The city agencies, you mean?
Yes, city agencies.
Okay, so the resolutions go to the city agencies, so they can look into what you guys are saying.
Yeah,
And then our
basically.
electeds are involved, and we really, when the electeds come to the meeting, that's another time. In this particular instance, that's really when we should bring it up in general board. When Mark Levine comes, Sean Abreu, we need them to be there, not just their representatives. Some of them have representatives we know will get back, but sometimes it's just, you know, some of the things they report on are an event, and that's important. But it's like low hanging fruit kinds of things, you know. But this is issues, these, what we've been talking about tonight are really critical issues that impact our health. And we should really maybe find some way to alert the legislators that this is coming up. We need to have you address, see how you can address it, and we can help you address it.
Okay, so I just wanted to know what the trajectory is, because if you guys keep writing resolutions and there's no
In
accountability
our
for those
instance,
resolutions.
we've been following up in
Mhm.
our instance.
Okay,
I mean,
thank you.
But that's
I-
just recent. That's recent. So we'll, you know, we'll see. But still, it's an enforcement. We still, in following up, like Edwin has pointed out, we'll come to find that in the follow-up, they're saying they cannot enforce it. So then we're, you know, we just have
So
to
the
find another
the
tactic.
city would say that they cannot enforce it
In a couple of
in some
instances.
cases? Okay.
Mhm. So that's
Interesting.
why we have an enforcement issue.
I would invite folks to attend CBA meetings and see the interaction that they have with city agencies. It is a completely different interaction than what we have seen with some of our agencies here.
Are
You
they
know,
the same representatives like with DEP?
Of course,
Is
it's
it Umberto?
NYPD, is FDNY, is DOB.
They're the same
It
representatives?
is, I mean, it's the same city, yes. It's,
No,
you
no, I know we're talking about the same city, Edwin, but
Yeah.
I'm talking about, sometimes the persons in,
No, it's not,
in those,
it's not the same
in
person.
those positions.
I remember that Monica wrote in one of the, you know, correct me if I'm wrong, Monica, please. You know, that we need to stop being so friendly with some of these agencies, that we need to hold folks accountable. And when you,
I agree.
I would encourage you to attend the Uniform and Services Committee. Attend the other meetings, see what happens. You know, just because I'm holding you accountable, it doesn't mean that I have something against you.
Right.
I would encourage folks to see CBA, go to their meetings. If they're on Zoom, please join so you can see the conversation that takes place with the city in those communities.
Yeah,
seems
but
like
the other problem is, look, if everybody loves the cops and no one's willing to challenge them, they will never be held accountable. And to be honest with you, Community Board 9 loves the cops. Nothing's
I think
gonna
they're
happen.
afraid. I don't think it's love. I feel like they're afraid. There's something going on, because I've sat in some of these meetings now, and it's like, oh, let's have 5 minutes, like a moment of silence for the police beating up this man, and then 3 seconds later, but we love you. Don't, it's not you guys. You have done everything you need to do.
Of course,
So
I agree.
there's a little weird psychological trauma thing going on for me that I see. No, seriously, I was like, what is going on? I'm sitting here. We're not saying that you beat this person up, but some of your, you know, your I guess,
culture,
partners,
yes.
the culture did. So
The
something's
culture
wrong with your
did, yes.
culture.
Yes.
I'm not gonna give a moment of silence for this person that just passed away, and I'm
Yep.
not gonna say, but thank you for your service in the same sentence.
Nope.
That is just psychologically crazy. Something is going
No,
on,
I
and I think
agree.
people
I
are
agree.
afraid.
Yeah, what
Sorry,
happens
guys.
at the same time is that, you know, because some of us are connected, you know, let's remember that when we walk around, we get a different treatment of what the community gets. And even being connected, sometimes it takes you forever to have an issue resolved.
Right.
I would say, please check CBA, see what the Upper East Side, how they handle their business, because, you know, we can't just continue to write resolutions.
They
without
handle
having
their
results.
business with money, because the people who are on community boards up there have money and have power. And if you mess with them, they pull those levers, not on the community board. They pull the levers they personally have.
But they,
And that's how the world rolls. They
But we-
use their personal connections on community board to instill fear on city agencies. Who do we have?
we need to make, since
Hmm.
we are the liaison between the city, we have to, be stronger advocate. The community needs to be aware because these folks, they are elected, they're not kings.
Oh, right.
So if you don't do your job, we should be able to get you out. People are running uncontested in our community.
So
It's
what do we
true.
do?
Ridiculous.
What do we
It
do?
is
ridiculous.
ridiculous,
What do we do?
uncontested.
Hmm.
So
It's ridiculous.
what kind of fear do I have of anybody telling me to do my job?
You're right. That's true. Same old.
Now,
same.
let me ask you guys, okay, so in my particular situation, I mean, this is 12 years. We have documentation. We funded we funded a study. We've done everything every agency has told us to have documentation. That's why the DEP responded so quickly, because they have such a long history. They're afraid that we're going to turn around and sue them, which quite frankly, in the moment of rage, that is what I am going to recommend to my board, that we unleash holy hell on the city.
You should. If that's a possibility that you guys have, you guys should look at all your options. Unfortunately,
You know what,
people pay
Jair, the
attention.
word of saying, yes, you should sue them, it sounds like a really cute thing, but suing takes a lot of time and a lot of money. And
Yeah.
and I happen
It's
to have
not
sat on my
fast.
board. It's not that quick and that easy. I
Yeah.
actually sued the city for 13 years, the Department of Education, and we still haven't resolved. So it's not so cheap and
Yeah.
quick to sue. The fact that we've been reporting this and done the due diligence positions us wonderfully to now, after 12 years, unleash holy hell and sue, because you have to build a case. That much I know, and it is extremely expensive to sue the city of New
I know.
York.
Yeah.
Right.
No,
And you gotta
You
be
have been
so
doing this for
patient.
12
And
years.
if
Right.
you have to choose between, your job and your time, and it's
Right.
hard. I think now, after this last bout with what's going on, I will approach my board and see if they do it. But again, let me tell you what a board on a private residency suing the city means. It means our maintenance goes up $450 a month to pay for a lawyer.
Yeah.
Nothing's free in this world. And
Oh,
let me tell you, it's very interesting to have myself and to have Carlton here, because he's fighting for NYCHA and I'm fighting for a market rate building.
Right.
And
And
so-
it's all the same. And that's
And
what I
it's
was
this,
thinking
and
about. It's the
and we're
same
in the
issue.
same boat.
Exactly.
Money,
Right.
like,
you're in the same community. It does not
you're in the
matter
same-
if you
yeah.
own
but
It's
that's
or
the
you
same
rent,
community.
because they think that we're not worth anything
Yep.
here in this.
and I
Yeah.
understand it. I understand this fight. Like I hear you, Jail.
Yeah, Jair. It's fine.
Jair, I totally
Jail is here
hear
too.
you that we have to get tougher. There is a culture change even within our community board to be more aggressive
Yeah.
towards city agencies, because there used to be a more like, thank you, ma'am, and hello, and like, let's just be buddy with them, because it is
And
a fine
status
line.
quo, everybody
Exactly.
just wants to get along. Nobody wants to challenge anything and, be the outlier with a different opinion.
We're having a cultural shift, in everything, even on community boards. And it is a fine dance, because we do have to work with them, but we do have to hold them to the coals. And we are reaching a point where the environmental violations are just too many.
Yeah, but they get
And
paid.
we know enough. They're connected. They're really hurting us.
Yeah.
Like, so my family members who were displaced by the fire on 141st, I was just thinking to myself, this is a family that spent 40 years in that building. The senior
them
members of that family know they both died under 70 years old of cancer-related diseases. You can't
that
tell me
fire
that's
didn't-
not environmental.
Mhm.
Yeah, we
Mhm.
have the highest asthma probably up here.
So
because of
we
everything
do
that's
have to
happening.
start paying attention to this, because it is killing us.
Yes.
And it's interesting, you said asthma problem, and Carlton mentioned the highest rate of COVID at the grand houses. A lot of
It
that
lowers
is our
their
lung,
immune
that's the whole thing,
system.
nasal, lung,
There you go.
areas of the body. Yeah,
I
it's all
think we have, I
interconnected.
think we have something big, really big here that we have to make a big stink about, because it's coming up in every form of housing that we have in this community.
I
And
go
not for-
back to what, and I'm
not
not
for-
saying other things
Not for
shouldn't be
anything,
done.
guys. One quick,
Oh.
other quick note. That damn depot that they're trying to build down the hill. That trucking station or whatever it is, it's not in
On
our,
145th, Monique?
it's not in our immediate CV, but it's gonna impact us as well.
Absolutely.
I think that's
No,
out
they
now.
they switched back to building the building.
Oh, that's right.
okay
Now
now.
it's back. That's
Oh,
right. It's
Lord.
back. The truck
Okay.
depot's gone, Monique. That was, you got to be fast on that one. But to
Yeah.
Heather's point about, to
Okay.
Heather's point about stressing the infrastructure, that new market rate building that now is supposedly 75 units of affordable housing on 155th, that is going to put a tremendous strain on the infrastructure of this community.
155th and where?
Between Riverside and Broadway, the tower, the tallest tower in our neighborhood across the street from the cemetery.
Mm-hmm.
That's going to be a huge strain on infrastructure.
Yes, and whatever, and if they decide to build 145th Street, that's what, 1727 Amsterdam Avenue, you know, all those additional floors that they're contemplating.
It's like
Huge.
all of this is going to impact the community.
Yes.
I think we just have to do, we still have to do, I'm glad you see the bigger picture thing. And that is, we do the resolution about the quality of life, particularly as it concerns these environmental toxins, get these other committees involved, and we just have to raise the stakes on it, start getting more publicity, getting the word out that, wait a minute, you know, the community is sick and tired of this. We need other outlets for getting the word out. There's some of the neighborhood outlets that are big. Even Columbia Spectator, they did actually there was something that was part of an email today in response, but that in that email, Edwin spoke, and I think Miriam, you may have been mentioned in that article. I'm not sure, but I did send it I sent it out to the committee, but it was the one reporting on the aftermath of the fire. And actually, the community, Columbia Spectator writers were part of this meeting this evening. There may have been as many as 3 of them. So I'm sure they'll be getting information, but we have to, I think, still do the letter resolution and get it voted on and said, this is our plan of action as follow-up.
And I would echo what Yair said. The community board needs to start holding everyone accountable. We're not here to be best buddies, so you can be my friend. Like, this is to conduct business. And if you're not doing your job, we're gonna have to have a conversation.
Yeah, but that's not this community board's culture.
We have to change it,
tell you that
Monica.
right
I
now.
agree with you. We have to, and we have to, you know, hold ourselves accountable.
And
Because
that, I
otherwise
feel that that's
we're-
probably changing. Yeah.
Because otherwise we're gonna be here the same thing. 3 years, the
Well-
reso was passed. Okay, let's do another reso. Another 3 years.
Right.
Yeah.
Alrighty.
Okay,
Okay, it's 9:17, everybody.
good. So I think we're
But
done.
I think it's all been good. I'm glad we were able to provide an update on what we've been working on. So it's not like we have people coming for presentations and it's just left at that. So there'll be some follow-up. Hopefully there can be a chart and we can itemize with each of the updates and with each of the presentations who offer something of what we want. We can provide an update and next steps. You know, that's something we might have to add into our minutes or as a separate document. Thank you
Okay.
guys so much. Is there
Right.
any new business, old business?
Thank
No.
you.
Yeah, thank you all. I just shared Community Board 8. Please, folks, look at a committee, attend, see the interaction, because just because we live in Harlem, we should not be treated any differently than any other place in the island of Manhattan or in the city. If we don't speak up, we're going to continue to get the same treatment over and over.
Jair made an interesting statement. She said, we seem to be in an abusive relationship with these people.
We are.
Like
We
an
are truly.
abusive-
It is. I was really like, my heart broke because I'm like, this is psychologically traumatizing that you are thanking the structural abusive person that's kept you down for all this time because you are afraid. We are too many to be afraid. We have to start. And like I said, I've been trying to lay low, but I'm not gonna take this anymore. And I am not gonna be afraid of anyone. These people are not doing their jobs.
Yeah.
I wanted to stay in my closet. Now they've taken me out, and it's not gonna be pretty.
Yep.
Can I add one other thing too? And especially since Yael and Jair are here, I put a message in the chat for you two at the community board, the general board meeting, and I didn't get a response back, so maybe you couldn't respond. But another way for us to really get the word out is through tenants associations. And Jair, if you have, if you know of other buildings and contact names for those buildings, please let me know. There are a couple of others who have tenant association relationships. We have to build that because if
Of course we can.
just between the two of you, and I think Edwin has one association, and I guess
Yeah, so-
most of us here, and that's a way of getting the word out. I just
So we
need the
have-
name of the contact, and then there's this group, like I mentioned, called Your Hamilton Heights Neighbors or something like that,
So-
and they are really chatting a lot with each other. And
That's
then
how-
there's
That's how I was
concern-
able to get Miriam the super's name, because 3609 is part of the Hamilton Heights Tenant Association. So we have 4 buildings where we brainstorm. We have, the leaders in each building. And we, since we're facing the same landlord, we come together and we try to strategize to advocate for these folks, because honestly, folks are not coming to the community board because
Yeah,
they
they're
come
not,
here and nothing gets done.
And then I know through Alicia, we can probably find out who at 3333 would be our contact, just to get the word out to as many people as possible. And then that's another way, in addition to our legislative people, to start getting some action or at least reaction and say, wait a minute, what's going on here? Grassroots, grant houses. We have Carlton here. We just have to, and Manhattan houses, we just have to get those tenants associations lists, and I think we're on our way to something.
We have those lists.
Okay,
Good evening, everyone.
great.
We have those lists. You have to think about this. Utah has a list that she's shared with me in the past. The elected
That's an old,
offices,
well, it depends on how new that list is. I know that, yeah, I have one from her.
some
in
is
the
relevant,
past.
not all of it, but some is relevant. But also your elected officials should have a list of all the groups in the neighborhood that they work with. Because I used to work for Robert Jackson in the past, and that's what we had it set up. And I have my own.
Is that
list.
Yael talking?
Yes, this is Yael talking.
Okay.
I have my own list from when I used to work for the Harlem Children's Home, because they used to fund and support Black associations and tenant associations. They used to support 37 of them back in the day. They used to do funding.
Oh,
for that.
wow.
And that has shifted, right? That grassroots organizing has shifted because it's not convenient to have people together.
Yeah.
So think about that, right?
With COVID, yeah.
You have some contacts from 75 St. Nicholas Place. There's 2 groups there, and 155th Edgecombe also has a group, because my building is part of that. So what I would suggest,
Yeah, we could easily we need to get information out
we
on
could do a
health
Google Doc and put all
conditions.
these in. We could do it.
Yeah, I'll be
Organize
in
it.
contact, or Yael, definitely call me if you haven't heard from me in a couple of days.
Yes.
Because I did have your phone number, but I'm not sure I still have it.
I will definitely send you my number and my email. I have your email.
Okay, great. Send it,
Also,
and so we can get to
I have
work.
space. If we wanted to hold some kind of meeting with all the groups, we can organize a summit. Like, what's going on? These things used to happen before.
That's a great idea.
All the groups can come together. I have space for that. I volunteer the space for that. I can help organize. We can all come together and organize it.
Oh,
How
thank
many
you.
people will your space hold?
275.
That's
Okay,
great.
That's enough,
We
yeah.
have several. Yeah, because we can, I think a big thing is we have so much important information, but it's not getting out. It's not getting out to
And-
the extent we need it to get out.
And also, you know, when you are running uncontested, I can care less what everybody else says because I'm going to get reelected regardless.
Yeah.
So you
Yeah.
can come to my,
Contested him. You should have contested him.
you know,
Come on, Dr.
yeah.
Torres.
Yeah, you know, yeah, but yeah, we need to have, you know, more than the historical, like you said, the abuse relationship, right, that we've been having. And that relationship, it carries also with our electeds, right?
Yes.
I think that we have to, you know, these issues, hold them accountable to it.
Yes,
Because
we have
that's what they get paid for, all of them, not just, you know, city council, this is the
They work
Senate, this
for
is the
us.
assembly, they work for all of us. To have Miriam and to have, you know, Mr. Davis coming from housing and complain about this is ridiculous. You
Yeah.
know? I mean, but folks feel like they can get away with it in this community, and they have for many years.
And that's why they feel comfortable. So we need to make them uncomfortable now. We need
Yeah.
to stand up and do what we need to do. So I can go, we can like this whole block, I can go and knock on all the buildings to see they have tenant associations, and if they need to form up, because we're gonna need one for the drama that is happening in our corner with all that traffic. That's like that accident waiting to happen, the tragedy that's waiting to happen. And we have to, you know, like you said, we have to do the work, right? Gather the evidence.
Yeah,
and
we
that's what we're
have
trying to do now.
we have presenters, we have people who know, we get valuable information, we do the resolutions, and we gotta now say, we need enforcement, and we need the people to help come out to say to them, it's a new day. It's a new day.
Amen.
All right,
All right, sounds
everyone.
good.
So I'll be following up with people over the next week and a half. And you know, so we'll see what we can do so that, you know, people come to us for help, don't feel like, you know, all this loss or is meaningless, you know. Thank you all so much.
Awesome.
Okay.
And Uniform and
you.
Services, they're meeting this Thursday, folks, for
Yeah, let's
issues
all show up
parking.
there.
And you look for Manhattan Community Board. That's the name used for the Zoom meetings on the community board. It's under Manhattan Community Board. Okay.
All right.
All right. Thank you
Sounds good.
so
Thank you all.
much.
Bye-bye.
Can
I
we,
was
oh,
closing
we
the
moved
meeting.
to adjourn?
Oh,
I
yeah,
move,
say,
I move.
second that motion.
Okay.
26.
All right. Good night. Thank you
Good
all.
night.
Night, everyone.
Bye-bye. Let's see, turn the recording off. Let's see, and.